Good afternoon, everybody. Thank you for coming. I can see people trickling into the attendees window, but I think there are enough of you here now that we can get started. So thanks for coming. Thanks for coming to the second iteration of the author Q&A series hosted by the Center for the Study of Human Health here at Emory and graciously co-sponsored by the Georgia Center for the Book. We're really grateful for their support and for any Georgia Center for the Book supporters who have joined us as a result of the email blast they sent out earlier this week. Thank you so much. I'm Maren McKenna. I am a senior fellow in the Center for the Study of Human Health and a science journalist and the author of a couple of books. And I am thrilled to be able to use this series to get some attention for books that have come out during the pandemic, have not been able to take advantage of the regular channels by which we authors speak to potential readers about our books. And the author you're going to hear from today is Emily Anthes, author of the amazing new book, weirdly apposite for this exact time, and we're going to talk about that in a minute. The book is The Great Indoors: The Surprising Science of How Buildings Shape Our Behavior, Health, and Happiness. Emily is a science writer. She writes for all the top magazines. She has won several of the top awards from the AAAS and the NASW Science and Society Journalism Award. She has degrees from Yale and also from MIT. And I love her work, and I'm so thrilled that she's able to be here today. So Emily, thanks for joining us.
Thank you so much for having me. I'm glad to be here, and thanks to everyone who's taking some time away from their days to tune in.
So I just want to remind everyone that that we're going to go for an hour plus, as long as you are interested. You can type in your questions to the Q&A box at any time. We're going to begin this Q&A with me asking Emily some questions. We'll do that for 20, 30 minutes. And then if you have interesting questions for us, we will turn to those. But we can see them, see the Q&A, see what's put in the Q&A box, even though possibly no other attendees can see them except for the one, if you were the person who typed it in. So when we get to those audience Q&As, I will speak them out loud to Emily. But you can put those in at any time. You don't have to wait until the audience portion of the Q&A begins. So, Emily, I love this book and I want to talk in just a moment. I also loved your previous book, Frankenstein's Cat. So I'm thrilled that you had two great books. And I want to talk in a minute about the issue that overhangs all of this, all of our lives in this book as well. But the first thing I have to say, because I saw it right away and started to read the book and it made me laugh, is you say that you're indoorsy. You are a person who likes being inside buildings. And so even understanding that that's your frame, I would love to know, out of your affection for the indoors, was there any particular impetus for this book? Anything that got you started on it?
Yeah, I mean, so I have always been indoorsy. I was, the kid that would go to the playground and take a book. And, so that has been a lifelong pattern for me. But in terms of this book, what really started, as you mentioned, I'm a science journalist, what really started me thinking about our indoor spaces in a more analytical way was actually some of the studies that were coming out like maybe a decade ago about the indoor microbiome. So, as I'm sure you do, I spend a lot of time just sort of like perusing the scientific literature. And I started noticing like a number of studies where ecologists and microbiologists were going into homes and offices and public restrooms and, swabbing surfaces and sequencing DNA and like publishing these huge lists of all these invisible creatures that were in our buildings. And so I thought that their specific findings were really interesting, sort of the richness of that world, which we can talk more about. But it also sort of sparked something in me where I realized like, oh, my home is an ecosystem and there are all sorts of complex things happening in buildings that not only do we not see, but I don't even think about. And like, what else could we learn if we turn sort of a scientific lens on our very familiar spaces? But the initial spark was some of that microbe stuff.
So actually, so let's go to that right away, and we'll come back to the big issue overhanging all our lives right now. The beginning of the book where you talk about how our homes are ecosystems. Well, all of our living spaces and workspaces and care spaces are ecosystems and are occupied by so many species that are not us. Are you okay with that? I found it a little squeaky.
Yeah, that I am mostly okay with that. It's not something that grosses me out terribly, though I understand that response. And just for everyone tuning in, if you haven't read the book, just to like throw out a couple of numbers. So one study calculated that the average American home has roughly 2,000 different types of microbes in it, and an average of 100 different species of arthropods. So, these are like the sort of mind-boggling really high numbers we're talking about. I think if I saw like visible mold in my home, I would be grossed out by that. But I almost look at these species and these communities with more of a sense of wonder. I mean, that's what got me interested in it, was the idea that an ecosystem is something that happens and exists inside my home. It's not just something that is like the real nature outdoors. I found that amazing. And, when I started reading about how certain unique species are evolving inside of our buildings and, the idea of like life finding a way, it was more a sense of wonder, I think I responded with than being grossed out. And I guess this is a point where I should also mention that, like, yes, some of these species are potentially dangerous and harmful for our health, but the vast majority are benign, and some are probably even beneficial. So objectively, the scientists who do this work don't want us to freak out, though I understand that that's a natural response.
So are you ever caught at a moment like when you're about to wipe down your kitchen counter and think I might be like eliminating a thriving civilization without knowing it?
Not lately. I mean, definitely like in the early days when I was immersed in this, I would think about that a lot. It's sort of no longer top of mind, but it's something, I've been thinking about again in terms of the pandemic. Like most people, I'm probably cleaning a bit more inside than normal. And so I am thinking about like, well, at what point are you doing more harm than good? There's not an answer to that, but it's something I've been thinking about.
So we should probably just get to the pandemic. So I'm really curious what it felt like to have the book. The book must have been in post-production at this point, right? Like at the point where everything kicked off in the spring. To know, even though the public hadn't seen it yet, that you had written a book about our relationships to buildings, and the entire world was about to go inside buildings and stay for some period of weeks or months. What did that feel like?
I think it took me longer than one might think to even really put that together. I think even as lockdowns and stuff were starting, I had friends who had books coming out like in mid-March when things were really getting bad. And, I was watching their book tours be canceled and I was like, oh, like, thank God my book's not out till June, because surely everything will be back to normal by then. So I think it took me a while to like really register. But yeah, I mean, it was sort of two feelings of ambivalence. I mean, one was that, oh, great, like people are going to be really interested in the indoor environment now. On the other hand, like I was a bit bummed that this would have been a great thing to talk about in the book and to like drill down more into, infectious disease in the built environment, which I talk about a bit, but, the writer part of me was like, oh, what great material.
And you couldn't quite pull it back and like write a new postscript. Yeah.
Yeah, well, actually, we're talking about that for foreign editions in the paperback. And I have been writing like some standalone freelance pieces that like pull out some of the lessons from the book and sort of contextualize them in the frame right now. But yeah, I mean, as you said, the book was done. Like the words coronavirus and COVID don't appear anywhere in it. So fortunately, I think the pandemic just highlights some of the issues that I talk about in the book and like the importance of the indoor environment. It doesn't like hugely contradict the argument of the book. So So hopefully it's a platform that makes people more interested in what's happening in our indoor spaces.
So did because you're in New York City, which was hit so incredibly hard by the pandemic and where the quarantine orders were very strict, unlike here in Georgia, where Emory is and where I am sitting, where our relationship to some of the public health distancing measures has been a bit more idiosyncratic. Um, did you feel like you were coming to a new understanding of your own material because you were living through things that you had described in the book but would not have experienced? I'm thinking especially of your chapter about the built environment of prisons and how the design of prisons, especially solitary confinement, has such a profound effect on mental health and how that potentially can be changed. You know, we all were in some degree of not solitary for the more fortunate among us, but we were all in confinement for a while.
Yeah, I mean, I did think about that a fair amount. And one of the things that the research on solitary confinement makes clear is just how crucial like social connections are to us as humans. And, I think that's something that people sort of instinctively knew. You were seeing a lot of stories written in the early weeks and months about how to maintain social relationships. And obviously what we were going through was not nearly as extreme as solitary confinement, where people are literally cut off from others for, it can be years. But it really highlights how our social relationships and interactions aren't just like a luxury. They are a physiological and emotional need for us as humans. And so I was very aware of like what that isolation can do. I mean, fortunately, I live with a partner, and so I was not that isolated, but I thought a lot about the people who were quarantining alone and how difficult that might be. The one other thing that actually I thought about a lot, which was not prisons, but towards the end of the book, I have a sort of short chapter on building in space. And there's a lot of research that's been done on sort of what happens to humans psychologically when they're cooped up in isolated and confined spaces. So not solitary, but maybe on, the ISS with 6 people not of your choosing for months on end. And so there's been a lot of work documenting what a stressor that can be. And that's sort of the flip side of the social interaction piece, which like in addition to needing relationships, we also really need privacy and personal space. Which was more of a challenge for me, like, sharing a 1-bedroom apartment with another person. But it's really a balance between both of those things, which research on other environments has prepared us well for, I think.
I want to ask one more question about the prisons chapter,
yeah,
which is that I was really moved by the voices of prisoners who've endured solitary confinement or are enduring it now. In the book, you have written correspondence with several long-term prisoners. And I'm really curious how that came about. I imagine that is not the sort of thing you can organize quickly.
No, and that was something that I wanted to try to do, throughout the book whenever, I talked to a lot of architects and designers, but like also the people who are in these environments, whatever the environment is. I thought it was really important. I wasn't sure how I was going to do that initially. I ultimately found there's an organization called Solitary Watch that's like it advocates for change and the abolishment of solitary confinement, the abolition. And they frequently publish columns and poems and writing from men and women in solitary. And often, if the men and women are open to it, they will include their mailing address at the bottom of the piece of writing. A lot of them really welcome communication and letters because of this social interaction. So I wrote like 20 letters to a bunch of them, and some wrote back and some didn't, and some turned into a longer correspondence. And one I even ended up speaking to on the phone a number of times. But yeah, I found it surprisingly moving to hold their letters in my hand, especially, some of these men have been in solitary for more than a decade. And that's, a kind of hardship that even quarantine, I think, can't really prepare you for what that's like.
The portrait that you paint in the book of how prisons might be physically changed to be how the built environment of prisons could be altered in order to be more friendly to the human spirit is sort of maybe the most kind of, it's the furthest along the spectrum of the things you talk about throughout the book, which is ways that the design can be deployed to our benefit or to our comfort, not just in prisons, but ways to improve housing, ways to improve offices, even though most of us aren't going to offices now, ways to improve schools. The school was fascinating. And all of those portrayals are both so rich and so detailed about the ways that those different buildings could be changed. And I'd love to hear you talk a bit about sort of which you enjoyed the most and which you, since you go to all of them, and also which you think actually might get built into the real world as opposed to just the sort of, you know, the what's the word, the prototypes that you saw.
Yeah, I mean, I think in general, so the buildings I tended to visit like really went all in on some principle or another, like everything we can possibly do to try to make this jail more humane or this school healthier, or whatever the example was. I think those types of projects are likely to be relatively rare, but I think we are starting to see a lot of designers and developers like apply smaller lessons and bits and pieces. I think one area that has a lot of momentum, it's still a niche, but a lot of momentum, is the idea of designing for neurodiversity. You know, building accessibility and has been sort of a topic for a long time. There are a lot of improvements left to be made, obviously, a lot of inaccessible environments, but historically it's really focused on sort of creating quote unquote access for people with physical disabilities. And that idea has now broadened quite a bit to think about, one, we don't just want access, we want people to really feel welcome and at home and be able to use these spaces, but also like lots of people have chronic illnesses and less visible disabilities. And so how do you design a welcoming space for an autistic person or someone with PTSD? Or someone with migraines. That's something that was not really a conversation a decade ago, and there's a huge surge of interest in. So I think that's particularly interesting. I could go on. I don't know how much.
No, I think you should. I think you should. But what I'm going to say, I want to just say something to our listeners first, which is you could. This is just a reminder that you can put questions into the Q&A box at any time. You won't be interrupting our flow if you do that. Because there's going to come a point in about 15, 20 minutes when I turn this over from just Emily and I talking amongst ourselves to incorporating your questions as well. And so I would love to see some questions starting to stack up in that box. So I thought of myself as being fairly familiar with the idea of designing for at least physical disability, or what we might now call, I guess, universal design, that idea of like design across the lifespan so that people can things like the width of doorways are the right width if someone needs in the future to use a wheelchair, or door handles can be changed if people start to lose their grip as they age. But the idea of designing for intellectual disability or social disability in a way was really fascinating, and because it incorporates so many aspects of design, allowing for sound and for surfaces and for the degree of sort of access that other people have to your space. So could we hear a little bit more about that?
Yeah, I mean, I think that, trying to think about the right way in. I mean, so I guess one of the interesting ways to look at it that some of the sources put it to me is you can think of building occupants with various disabilities as in some ways being, I think what she called quote unquote extreme users of the environment. And what she meant by that is that often disabilities mean that someone can't tolerate the bad design decisions that are around all of us. So if you're talking about an autistic kid, they might be very sensitive to noise. If you're talking sort of at the other end of the spectrum about, a 90-year-old with dementia, they might not be able to tolerate a building that's poorly laid out and that's hard to navigate. And so I think what's interesting about this is even though you could create sort of an endless list of chronic conditions and disabilities, and you might think, well, like, how can we possibly design for everyone? And there is no one size fits all environment. A lot of these principles and best practices really end up making these spaces better for everyone. So you have more soundproofing, then that's, you know, great for all building occupants. If you make a building more intuitive to navigate, you know, you don't have to have dementia to appreciate that. And so that's partly what I really liked about that story, was that some of these disabilities and occupants with these disabilities really point to ways that we can make our buildings better for everyone.
So let me ask you about that, because you know, we can hear the sirens going by. You live in one of the most dense cities on the planet. And a lot of the housing stock in New York is old, right? It's buildings that, even though they've been multiply improved, some of them might be 100 years old, or they might be post-World War II. So the sense of what was appropriate for a living space has changed a lot in those decades. Do you look around your particular built environment, whether it's your apartment or your building or your block, and see it with fresh eyes now? Do you see ways that it could be improved, or that you'd want to improve it?
Yeah, I mean, certainly from an accessibility standpoint, I mean, there's still a lot of room for improvement, even in just the sort of traditional ways. You know, I've never not lived in a walk-up. So like all the buildings I've lived in are not wheelchair accessible, because none of them have elevators. And like that's fairly common here in New York. You know, the public transit is pretty notoriously inaccessible. We have this great subway system, and just, I don't know what the latest number is, but it's a tiny fraction of stops that even have elevators. So from an accessibility standpoint, there's a lot of room for improvement. Do you want to talk broader than like other design improvements as well?
Sure.
Or,
yeah, absolutely.
I mean, so one thing that the city has gotten better at is public space, and thinking a bit more about pedestrians and green space. I mean, there have been new parks added, new, you know, like medians. And I think the pandemic has been instructive too, because actually for, you know, how stressful things have been in the city, in some ways this summer, there were moments of joy in it, because streets that were given over to cars had been closed down entirely, and it was bars and restaurants, like, you know, out in the middle of the street. And I think there's a lot more that could be done to create built environments that put people rather than vehicles first. And I think some of that has been highlighted by the pandemic. You know, it will be interesting to see what the city does afterwards, but I think there are a lot of people hoping that some of that sort of pedestrian friendliness might remain.
Yeah, it's really moving to look at some of the pictures from New York or from Paris, or some of the other European capitals, and see that the cities have just decided to just banish cars, to say to the restaurants on a street, you can have this street, right? Or to turn an intersection into a parklet or something like that. It really feels as though the human experience of the city is taking precedence over the city as sort of like a place where that vehicles go through to deposit people. I wish that were happening more where I live, where we're still struggling with things as what is seemingly basic as bike lanes. So, you know, one of the things that sticks in my mind about New York, to stick to New York since you live there, is how much some of the intense weather events of the past decade plus, 2 decades maybe, have really impacted the city. I think of Hurricane Sandy and the subways flooding, and in your travels around, interrogating this question of the structures of buildings, you met some people who are doing some really innovative things about designing housing for climate change, and other buildings as well. So could you talk about that a bit?
Yeah, so, you know, as viewers might be aware, like sustainability for several decades has been like a big watchword, a big trend, green building, and it still very much is, but increasingly you're seeing a lot of designers and people in the community talk about resilience. And that sort of means creating buildings and environments that can withstand extreme events, whether they're weather or, you know, human-made, and bounce back. And so there's no one secret to it. Like resilience is very context specific. You know, what natural disasters I might be facing here are different than in LA or somewhere else. But designers are getting really creative and coming up with all sorts of ideas for creating buildings that survive different disasters. One of the examples I feature in some detail in the book is this idea of amphibious construction. So, if you think about houses that are built near a beach or in a flood zone, often they might be raised up on stilts. So that's permanent elevation, but for a variety of reasons, homeowners tend to not like that and communities don't like that. And so one architect and engineer I met with has come up with a system where basically, the specifics vary, but essentially you build houses on a buoyant foundation. And if there's a flood, the water comes in, the house essentially acts as a pontoon raft and sort of lifts up off its base and floats on the surface of the water. I should say it's attached to sort of guidance posts or poles. So they might stick, wooden or metal poles around the house and like lash the house to it, so the house doesn't, float away down the street. And then when the waters recede, it sort of lowers itself back down into its original location. And so that's one of many sort of innovative out there ideas for like, how can we really design for what is sure to be like a pretty turbulent future?
So the question that you referenced when you started talking about design for climate of balance is really interesting to me. How do you balance what you do to buildings to protect them against some extreme weather event with the desire to sort of honor the urban environment the rest of the time and not ruin pedestrian interaction, for instance, or even just the look of a streetscape? I used to live in Minneapolis, and all of downtown Minneapolis is connected because of its severe winters. It's connected at the second floor of all the downtown buildings by a network of glass tunnels. I think its official name is the Skyway, but I think of it as the Habit Trail, the gerbils go through. And the Skyway is amazing when it's -10 outside, because you can leave your office. Back when people went to offices, you don't even have to put your jacket on, and you can go get your dry cleaning and get your shoes fixed and go to a restaurant and so forth. But so that anticipated an environmental intensity of some kind. But the downside of it is that it completely killed pedestrian street culture, because all of what we would think of as the kind of pedestrian culture that exists in New York City, where there's a mix of small scale retail out there at the street where people pass by, all of that is up in the sky inside glass, and because people can't use the streets 6 months of the year. And as weather gets even more extreme, it seems to me that we're going to have to study that design balance more and more to figure out how do we not injure cities or buildings in the times when extreme weather isn't happening, while trying to preserve them when weather does happen.
Yeah, I mean, and that really gets to sort of how much we ask and need our buildings to do. So like, at the most, you can sort of think of like the Maslow's hierarchy of needs almost, like absolutely, like at the most basic level, they provide shelter and need to keep us safe and like away from the elements. But they're also how we create, where we create families and how we create communities and social interactions. And so, you have to think about all those things in a design, and there are sometimes trade-offs and hard, difficult things to balance there, but it's not enough to just create a building that will like literally keep you safe from a hurricane. It has to do a lot of other things too.
So that actually is a great segue to one of the questions that one of the audience members has asked, which I'm going to start turning to now. And that is if you could talk about the issue of light in buildings. To what degree do buildings have to allow, or should they allow for access to natural light? How can designers and architects compensate for that if natural light isn't available or can't be designed around? And this isn't in the question, but I'm going to tack it in, I guess our big windows or something like that, or baffles or skylights or something, are they a weak point for buildings that make them more vulnerable in cases of extreme weather or climate change? But light is the central part of this question.
Yeah, I mean, so to answer your question sort of quickly, first, they can be, and they can also, this is another place where you get a trade-off where, so I'll go back to this in a second, but like the short answer is that daylight is really good for us and we should try and maximize it in all sorts of ways. However, often if you have like wall-to-wall, floor-to-ceiling windows, these huge windows, that's a source of energy loss too. So then that begins to compromise, or can, your sustainability of your building. So like those are some of the things that designers have to balance. But daylight is one of those elements, like nature, that just has a stunning array of benefits, extremely well documented in the literature. I mean, a lot of things about indoor environments come down to like personal preference, but like daylight seems to be good for everyone. And particularly morning exposure to daylight. We know that it's that morning exposure to sort of bluish cool light that is coming from the sun that helps entrain our circadian rhythms or keep them pegged to the solar day. So if you get plenty of light exposure in the morning, that not only helps you be more alert during the day, but it also will help you sleep better at night. There's also, you know, just I'll quickly list, like daylight has a well-documented connection to mood. The mechanism isn't quite clear, but there are studies that suggest that it can boost serotonin production. It can improve focus and productivity. It improves things like even just like job satisfaction. I guess the other part of the question was how to make the most of it. You know, obviously big windows that allow lots of light in is great. Technology is giving us some, you know, solutions if that's not a possibility. The school I toured actually had some sunlight tubes. So like if you are on the top floor or in a building that, you know, allows it in engineering, you can sort of install, or engineers can install these tubes that pull sunlight in and bounce it around and bring it into a room, things like skylights. We are now even getting circadian lights and bulbs. So these are like smart bulbs that mirror the way the color, temperature, and intensity of sunlight changes throughout the day. So they put out that cool blue light in the morning and then become more amber at night. So actual real daylight is the best solution if it's possible, but if not, we are starting to get some alternatives.
So now we've got lots of questions. That was just the first. Now I just have to decide which we're going to answer in what order. So I think a couple of people are interested in the issue of cost, which is an important feature in everything that you've talked about, right? That these designs or redesigns may pay for themselves down the road in a variety of ways, but they aren't necessarily inexpensive to execute to start with. So how do you think about the issue of the cost of better design, and just how did you think through that?
Yeah, I mean, that's a good question, and absolutely is a real issue. You know, there's a lot of inequality in who gets access to good environments and who doesn't. I guess a couple of points, a couple of responses. One is that it remains a real problem, and that some of these technologies and solutions are too expensive, for sure. But they don't have to be. Like a number of the buildings I toured, like I toured probably the most beautiful elementary school I've ever seen that had been carefully designed around daylight and nature and physical activity. And the designers were really careful in how they created the building and what sorts of elements they incorporated, and the design features didn't add a single dollar to their budget. And then I guess a third thing which you mentioned is some of these things do pay for themselves over time. So I'm thinking about hospitals. There have been some studies about like using all the best evidence-based design to design a hospital adds something like $4 million, something that to the cost of construction, which is not that much in terms of a hospital budget. But by reducing medical errors and improving patient outcomes within a year, it's more than paid for itself. And then I guess the fourth thing I would say is that we need to be more creative about looking for solutions. And I talk about this explicitly in the sort of sustainability resilience chapter, because often the projects and solutions that get like a lot of press and attention are the multi-million-dollar smart home with radiant floors and all this stuff. And, you know, that's fine if you can afford it, but most people can't. And we can't, you know, the people that really need sustainable, resilient buildings are often people lower down on the income scale. But it doesn't require all this fancy technology. So I mentioned briefly, like looking at vernacular architecture, you know, human civilizations for centuries before we existed or LEED existed had figured out really creative ways to create habitable homes in really harsh environments like deserts or tundra. And there are a lot of lessons there about building shape and orientation and size that we can apply that aren't as cost sensitive. So it's a complicated question, and that was a bunch of answers. But
so I'm really glad that you mentioned the issue of vernacular architecture, because another question that we've gotten is whether, to what degree design or the design of the built environment is becoming globalized. Are traditional structures or culturally specific structures becoming, are they being built less, or are they being squeezed out by the questioner doesn't use this term, but I'm going to use it, sort of the IKEAization of design that we, you know, sort of the what seems like the global design ethic. How do we think about that?
I mean, I don't know. I haven't looked into it enough to be able to quantify. I mean, I think there is a sense that that is happening, and I've also seen it referred to like the Airbnb of the world.
Right.
I've read
every Airbnb picture looks the same, right?
Yeah,
They've all got the same vases and the same pillows.
Spaces.
Yeah.
I think that is. I mean, I think most people would say that there's a sense that that is becoming more prevalent and more of a problem. Like, I don't know that it's been quantified, but I think it is potentially a problem. I mean, you can almost think of like vernacular architecture and traditional and regional specific architecture like, you know, plants, and that like when certain plants die out, we lose the ability to maybe make drugs from them or food from them. And so like there's knowledge that's contained there, or potential knowledge that if it disappears, you know, we're not going to be able to learn from how this culture has dealt with, you know, this natural disaster historically. So it's certainly something I would hope we can preserve. I think it probably is an increasing challenge.
Yeah, I thought when you say that, I think of the story that someone told after the tsunami in Japan, that at the point where one of the points where the tsunami came ashore, there was a sort of an old warning stone that was standing up. The message on the side of it said something like, "Do not build south of here," or "Do not build from here to the coast." And of course, the entire coastal plain had been developed, and it was all washed away. So we've been talking about kind of individual buildings, about a school, a prison, and so forth. And is there a way to, or is anyone applying the sort of principles that you're talking about to sort of to architecture in the aggregate? Are people replanning cities or towns in the way they did in the 1950s with the sort of the post-war planned towns like Levittown or the garden cities of the UK?
Yeah, absolutely. So a lot of this is also part of like urban planning discussions. I sort of deliberately stayed away from it, partly to keep the scope of the book manageable. Also, it's been written about, and if any of you are interested in, I highly recommend the book Happy City by Charles Montgomery, which is similar and has some overlap with my book, but really looks at a city planning scale. But yeah, from a couple of perspectives that's been done. I think probably the most prominent or most popular is thinking about the role of cars in our cities and suburbs. And there's finally starting to be a bit of a correction to, like, you know, American cities and suburbs were built and or redesigned to give primacy to the car. And I think there's now a rethinking of that, probably not a big enough rethinking, but, you know, how do we make these, as we said before, like spaces more pedestrian friendly? There's a lot more focus now on green space and urban green space. That's another place where you see a lot of inequality. Poor neighborhoods tend to have a lot less access to parks and trees and things that we know are really good for health. And then in terms of physical activity as well. So a lot of the field of active design, which I talk about a bit in my book, a lot of that is actually focused on the larger built environment and like, how do you lay out streets in a way that encourages walking and biking rather than driving? So there are absolutely people thinking about this on the city level. And some of the sort of really interesting and innovative work is happening there.
So I'm going to, there's an almost immediate segue here. One of the students who's attending has asked whether these kind of improved design principles are being applied to dorms. Are there things that can be done to improve the health and happiness of students living in dorm buildings? Did you look at that at all?
I didn't look at it specifically. You know, I don't know that I've seen like explicit building happier dorms case studies. That's not to say they don't exist. I mean, there's a huge amount of stuff out there that I didn't get into, but I mean, I think some of these principles, like the importance of daylight and nature, and we're now seeing with air quality and ventilation, are becoming so well known and so standard as best practice that it would shock me if dorms aren't, at least new dorms, aren't being designed with some of those principles in mind. So we haven't really talked about this at all, but so I have a chapter on smart homes and sensors. And that's a place actually where I've seen the most, like, especially now, but even pre-COVID, colleges and universities rushing to install sensors and tracking and stuff like that in dorms, which, you know, maybe is not as encouraging a development as some of the others, but I think we will be seeing a lot more of that. Not necessarily good news, but, you know, location tracking and, you know, there are dorms now that I've read about that come like pre-installed with Alexa and stuff like that. So maybe that's a little more dystopian angle on it. But.
So you just mentioned ventilation, and I want to put a pin in that to come back to it. But this question of to what degree the amendments to the environment may infringe on your privacy. I mean, you were just describing it in terms of students, but surely it's also an issue for the smart homes that are supposed to protect seniors. And this question of how much do we leverage the built environment to help people or protect the health of people in the home, whether those people want it protected or not, is a really interesting puzzle to me. How did you think that through?
I mean, very carefully. You know, it's another one of those things that there's not an easy answer to. I mean, I think some of these technologies, and, you know, especially when you're talking about ones that are like designed to help keep seniors safe in their home, have immense promise, but they're also can be risky, especially when you're talking about seniors or people who might have cognitive disabilities. There's a question of consent. But I think even if you're not talking about those populations, part of the problem with these technologies, and we've seen this happen over and over again, is even if you like read all the fine print, think really carefully about, okay, like I'm okay with them getting this particular information from me and using it in this way, that can change on a dime, and maybe not even with your consent. Like, you know, maybe the small company gets sold to Google and you're less okay with that, or information you gave away about your gait, which doesn't say much now, 10 years from now, maybe scientists can pull all sorts of additional health information from it that you didn't bargain for. So that's one thing that makes it really hard, is even if you know what you're signing up for in this moment, that these technologies aren't stagnant, they continue to evolve and improve.
At one point, does paternalism sort of like sneak in the back door of something that looked like it was meant to be just altruistic caring, right?
Right. I mean, I think the one encouraging thing, or an encouraging thing, is the researchers I talk to in this space are like pretty aware of these issues, in part just because they know that if people have these concerns, they're not going to adopt these technologies. But there is a lot of active thinking right now about ethics in the space and regulation. I mean, I will say we need more regulation for sure, but it's something that's very much a topic of investigation.
So in talking about dorms, you mentioned ventilation,
Mhm.
but both in the case of dorms and in the case of these potential protective homes for seniors, housing for seniors, there's that issue of, sort of like tracking people's movements. And both of those, I think, really directly relate to what's going on now with the pandemic, right? How much are we going to contact trace people? How much are we going to change the environment they live in? And several people have asked, do you see, precisely because of the pandemic and the quarantine orders, is this a moment where people are thinking increasingly about design? And is it going, as you look ahead, is there any likelihood that design principles or design implementation is going to change as a result of the pandemic experience?
I think it will. I might be wrong, but there are a couple of things I've been thinking about in terms of like where we go from here and what comes next. I mean, I think a big thing you're seeing a demand for right now is flexibility. Most of us in our homes like didn't think we would be working from home full time, maybe, or that turning our homes into a virtual classroom for our kids. And even at the level of like hospitals or offices, like suddenly you might have way more people coming into a hospital, or you might have an office that's sitting almost empty. And so I think in general, if we can make our buildings more flexible and adaptable and multi-purpose, whether that's like actual movable walls or reconfigurable spaces, things like that, I think we'll see more of, because, even if this pandemic, or when this pandemic passes, like there will surely be more crises. It might not, there'll be another pandemic at some point, but there will be floods and other things. So the more we can make our spaces flexible, I think that will sort of always make sense. In terms of to get like more granular, I think indoor air is going to become really important, or has become really important. It's an area that researchers were beginning to pay more attention to. I mean, we've traditionally thought about air quality as something that happens outdoors, and air pollution is something that happens outdoors. And that was beginning to change even before the pandemic. There are some really interesting studies that now dive deep into like, what is the chemistry of what's happening in your indoor air? And I think the pandemic is accelerating interest in that. I mean, one place, to be specific, that I see potentially changing is like, even before this, ventilation in our school system, our public school system, was just horrific. Mm-hmm. And even when there's not an infectious disease around, like that can cause health problems. We also know that poor ventilation can compromise our cognitive functioning, and that students don't learn as well. And so like, I think this pandemic has prompted some schools that can afford it, to upgrade their ventilation systems, and stuff like that, I think, is going to be a really important lasting legacy of this moment. There are probably others too, but those are the first two that come to mind.
So let me take another spin through the questions. You mentioned sort of what comes next in design, and several people have asked what comes next for you. In like, your first book was about, or your previous book was about animals, and now you're writing about buildings. That seems like a big jump. Can you talk about how you went from one topic to another? Was there a thread other than just your own curiosity that linked them?
Yeah, I mean, so I've never really had a really defined beat, which has its pros and cons. Sometimes I wish I were known as like the dinosaur person or the infectious disease person, because, sometimes it can be easier to get assignments that way, or people know, like your niche. Part of why I went into science writing was because, well, I initially thought I was going to go into research, and I realized I had like too many interests and they were too broad and I could never pick a field. So that's part of like why I do this anyway. I mean, I will say I've sort of realized that human and animal health, so the two of those are really like my main areas of interest. So like, as you can see, that leaves still a lot of room, from like, cyborg pets to school design. But I have an idea for another book that I'm not quite ready to talk about yet, but it gets back to sort of a human animal relationship interface. So I'm thinking about that, but I'm also eager to just go back to some shorter pieces. There's a lot more to say about the built environment in this moment. So I'll probably pitch some of those, but hopefully another book in a few years.
I think it's fair to give yourself a year or so off before you, I'm just at the point now, what my book came out 3 years ago, and I'm just at the point now of like getting ready to describe the next one, though I was probably ready in the spring before it went, and then coronavirus happened.
Yeah.
So let's just look at the last couple. Oh, these are all such good questions, and I know we can't get to all of them, so it's hard to decide which one to ask.
I will say, just sorry to interrupt, that if we don't get to your question, people are welcome to email me or find me on Twitter. Like, I am always happy to talk about this, so don't be shy.
So something that, because I'm in Atlanta and you're in New York City, and square footage prices are different in those two, I'm really intrigued by this question, which is, how much does in thinking about someone's living space, does the size of the space matter? Are people happier in bigger spaces?
I don't know about size as in objective measure. There is a lot of research on crowding, and particularly like the negative effects of crowding in housing. So when you start talking about, really large extended families squeezing into small spaces, we know that can be detrimental. That can have effects on stress and well-being. It can also be take a toll on child development and things like that. So there does seem to be some minimum amount of sort of space per capita that we need. I don't know off the top of my head what it is, but crowding was actually one of the first really well understood, well studied variables in housing, at least. So there is, there is a minimum, but even two of us in a 1-bedroom apartment, I mean, we don't come close to that. It's more significant crowding than that.
So there's no sort of estimate that you're aware of kind of like the right size for someone is, I don't know, 400 square feet, 900 square feet, 9,000 square feet in the suburbs, something like that.
There might be, but I don't know of it. I mean, and it tends to be, no, I don't want to say that. Yeah, I don't know the answer to that question. I'm sure somebody has probably done at least a calculation of like minimum recommended living space per person. And maybe actually even like someone like NASA has done that, because I could imagine that being relevant to them.
Right, probably for the ISS, right?
Yeah.
Okay, you get these 6 square feet.
Right.
We made it 6, not 5, because we know like 5 is bad for you.
Yeah, but beyond like that extreme crowding condition, I don't know if there's been research on like what it does psychologically to change the size of your space. That would be interesting.
So I'm going to loop around now with a couple of the questions, and then one final question from me to some of the things we talked about at the beginning of this hour. So this question of how all of our spaces have a microbiome. And I'll just say for the healthcare people who are listening that in the book, there's a fascinating discussion of the building of an opening of a brand new hospital in Chicago. And a research team studied how that building's microbiome became populated. And it's just an amazing piece of research and a great description of it. But do you have any thoughts, or probably this should be speculation, about how quarantine, how the experience of the pandemic has affected the microbiomes of our built environments? Are offices sterile now, or are our home microbiomes, have they changed because we're in them all the time?
So I don't know that the answer is out yet. I expect that scientists are studying that right now. I could make a few educated guesses. And so one of the things about our indoor microbiomes is they're actually more diverse, in theory, more diverse than the outdoor microbiome, or at least and that's because our indoor spaces are getting microbes from so many sources. So like we are shedding them from our bodies, they are also growing in our homes, and then we are also tracking in microbes from outdoors. I would guess that a lot of homes are probably the relative prevalence of human-associated microbes has gone up, and the prevalence of outdoor associated microbes has gone down, just because if we're coming and going less, then we are tracking in fewer microbes, and we are just, sitting in our homes shedding our own microbes all the time.
Mm-hmm.
So that would be my guess, but I don't think the data are back yet.
I wonder if the microbiomes of like abandoned offices are starving, like
Right.
there was some conversation relatively early when New York City locked down about what was happening to all the pests of the city, like Pizza Rat, right? Who was the animal that was like dragging the slice of pizza down the subway or up the subway steps. What was Pizza Rat going to do for pizza if no one was in the subway or getting pizza? And maybe the same thing has happened on a microbiological level as well.
Yeah, I mean, I think the ecosystems have shifted, and there have been some interesting data visualizations about how like trash collection and generation in Midtown Manhattan is way down because that's like all office buildings and no one's there generating trash. But like trash pickup in Brooklyn and Queens is way up because everyone's at home generating trash all the time. So we probably are seeing shifts in like insects and, rodents along those lines. So I think probably could expect the same thing with microbes.
So I'm going to ask my last question, and I guess this is
Okay.
going to be kind of a 30,000-foot question.
Okay.
So fairly early in the book, you have this lovely account of the way that the first time that in the modern era that we really began to understand that cities affect the health of inhabitants, and that led to things like clearing up the horse manure in city streets and allowing for sewage and stormwater runoff to be channeled into particular places, and making sure that that apartments were built with access to air shafts so that everyone had, at least even in the tenements of New York City, had at least a little light and fresh air. That I'm not exactly sure what the term is for that, but that giant sanitary revolution of the sort of last half of the 19th century made an incredible difference to the health of populations, forced down the rates of all kinds of diseases and increased lifespans. And so it was an amazing demonstration, as you explain, when you look back historically, of ways that changing the built environment has a really direct effect on the health, not just of individual people, but on the health of cities or nations, on the health of population generally. That was a huge sort of organizational and in a way kind of emotional or philosophical effort to create all that change in cities. Can we do that again? Would it be possible, do you think, for us to summon that sort of burst of energy and innovation to remake design another time to improve health further in the way that your book talks about?
I hope we can, and I think it is possible. But I mean, I love that question because that's something that I really came to understand after spending a few years on this topic, and my views became a lot more nuanced about realizing that, like, yes, design has enormous potential, as you say, for improving our health and well-being. And we now have a lot of data and a lot of knowledge about how to remake our environments. But that alone isn't going to get the job done. We need political will. We need sort of a societal rethinking of what we value and who we value and what our priorities are, and funding for public housing. And so like the design knowledge and the evidence is a really important piece of that, but that on its own isn't enough. So to get back to the actual question, like I think we can, and we now have the tools to do it. What we need are political and societal will, and money, and deciding that this is going to be a priority. Because I mean, that's another sort of theme too, is that design is a reflection of our values. And so like there were a reason those tenements were built I can't think of a better word, but so crappily, it's because those people were not a priority and their health wasn't a priority. And so it is going to require that kind of social shift. But we have the tools.
That design is an expression of our values, I think is just, that's wonderful. It's a wonderful summation. And this question of whether we that we're having this discussion in the midst of the pandemic has been a worldwide demonstration of what political will, or the lack of it, can do to affect the health of populations. Emily, thank you so much for spending an hour with us and with all the folks who have come into and out of this room, everyone from the Emory Center for the Study of Center for the Study of Human Health. Sorry about that. And the supporters of the Georgia Center for the Book. Thank you everyone for being here. To remind, the book is The Great Indoors: The Surprising Science of How Buildings Shape Our Behavior, Health, and Happiness. You should go buy it. It's fantastic. And thank you all for listening.
And feel free to find me online, honestly, if I didn't get to your question.
At emilyanthes.com?
Yes, or
Emily Anthes on Twitter.
Yep, or emily.anthes@gmail. You can just email me too. So.
Oh, that's fantastic. Thank you so much. All right. Thank you, everyone. Thanks for coming.